Good afternoon. Today we are going to discuss about pharmacology of acetylcholine. In the last class, we already discussed definition and pharmacological classification of parasympathomimetics. This topic is under the course outcome CO2 and bloom levels are K1, K2 and K3. First of all, what are parasympathomimetics? That is, these are drugs which produce action similar to that of acetylcholine either by directly interacting with cholinergic receptors or by increasing the action of acetylcholine by increasing the availability of acetylcholine at these sites. Okay. The drugs are broadly divided into two types. What are they? Directly acting agents. These are otherwise called as cholinergic agonist, and another category is indirectly acting drugs. These are otherwise known as anticholinesterases. Okay. Then the pharmacological actions are broadly divided into two types based on which type of receptor they act. Based on that, divided into muscarinic actions and nicotinic actions. First of all, we discuss about what are the muscarinic actions produced by acetylcholine. It binds with muscarinic receptors present in the heart. By that, it produces heart rate and force of contractions are decreased. That is, it reduces heart rate and force of contraction. Then if the drug is acting on muscarinic receptors present on the blood vessels, it produces vasodilation. By that reduces blood pressure, that is hypotension condition, and also flushing is produced. The next one is effect on smooth muscles. Overall, acetylcholine produces contraction on smooth muscle. Depending on the site, it produces different effects. That is, on gastrointestinal tract, tone and peristalsis rate are decreased. By that, reduces the evacuation of by that it produces bowel evacuation rate. That is, it increases evacuation of bowel. The next one is urinary bladder produces micturition. On bronchial smooth muscle produce bronchoconstriction or bronchospasm is occur. Then regarding the glands, by binding with muscarinic receptor, acetylcholine increases all glandular secretion like increased salivation, lacrimation, tracheobronchial secretion, gastric acid secretions, etc. Overall, all glandular secretions are increased by the action of acetylcholine. The next one is effect on eye. In the eye, mainly two types of muscles are present. They are circular muscles and another category is ciliary muscles. If it is act on the circular muscles, contraction of circular muscles produces meiosis condition, and contraction of the ciliary muscles produces spasm of accommodation, and also it is having capacity to increase outflow of aqueous humor. So these group of drugs are indicated in the management of glaucoma condition. These are about the muscarinic actions produced by acetylcholine. Then next move to the what are the nicotinic actions produced by acetylcholine. Main sites are autonomic ganglia and another site is neuromuscular junction and third one is on CNS. In case of autonomic ganglia, both ganglia and adrenal medulla are stimulated. That is ganglionic stimulation and also adrenal medulla are stimulated. Then at neuromuscular junction, that is NM type of receptors are located at a skeletal muscle end plate or at neuromuscular junction. In that area, it mainly produces contraction. That is, persistent depolarization produces paralysis of the skeletal muscles. The next one is in the CNS. In CNS, acetylcholine acts as a neurotransmitter. On direct injection in the brain, produces a series of action, that is initial stimulation followed by depression. These are about the nicotinic actions produced by acetylcholine. Then next discuss about what are the adverse drug reactions produced by acetylcholine. Based on the pharmacological actions, what are the adverse drug reactions? That is, it increases the lacrimation, salivation, sweating rate, etc. Then reduction in BP, that is hypotension is produced, flushing will occur, then involuntary urination, defecation. These are the main adverse drug reactions produced by the action of acetylcholine. Then next about what are the therapeutic uses. In case of acetylcholine, if it is administered via oral route, it mainly degraded by the gastrointestinal tract. That is, various enzymes present in the gastrointestinal tract is destroyed by the orally administered acetylcholine. So, oral route of administration is not preferable. But if it is administered by intravenous injection, it is metabolized by the choline esterase enzyme, especially acetylcholine esterase is degraded by acetylcholine into acetate and choline. So these two routes are not preferred by the in case of administration of acetylcholine. So acetylcholine solution is mainly used as 1% eye drops in some case of eye surgeries. That is, it is having meiotic property, that is constriction of pupil. So in some eye surgeries, acetylcholine eye drop 1% is mainly used. Then regarding the uses, bethanacol is mainly used in some conditions like hypotonia of bladder, GI smooth muscle, in congenital megacolon condition, then neurogenic bladder, urinary retention, post-operative paralytic ileus. These are the therapeutic uses produced by the or therapeutic uses in case of bethanacol. Then regarding the classification, we already discussed or we already studied that directly acting drugs are divided into two types. What are they? First category is choline esters and second category is alkaloids. Acetylcholine is under the category of choline esters. Then next discuss about what are the actions produced by alkaloids. The main alkaloidal drugs include examples pilocarpine, aricoline and muscarin. In that, pilocarpine widely used drug mainly in case of glaucoma condition. In case of pilocarpine is a naturally obtained alkaloid. It has both muscarinic and nicotinic action. Like acetylcholine, it increases various secretions and also it having capacity to produce contraction in muscles, etc. Then when it is applied to the eye, it causes miosis and also ciliary muscle contraction and having capacity to reduce intraocular tension, that is fall in IOT or IOP. So it is used in case of glaucoma and used alternatively with the mydriatic. Example for mydriatic drug is homatropin. In case of mydriatic agents, it is used alternatively to produce miosis and to counter dryness of mouth when it is followed by radiation of neck and also head. That is pilocarpine having capacity to increase the secretions, so it overcome the dryness of mouth. These are the pharmacological action or description regarding pilocarpine. It is an alkaloidal agent. Okay, thank you.